Okay, hello everyone. It's now officially 7 o'clock, so we can get started. Thank you everyone for joining us. My name's Sarah from the Pennsylvania Dental Association. We also have Tiffany Booher from the Physicians Health Program, and then Dr. Kim will be joining us shortly to discuss mental health and burnout tonight. We have a great presentation here for you, and we'll just get started in a minute. And this program is brought to you by the PDA New Dentist Committee. We do have a schedule right up here on your screen. It's an hour and a half program, and there will be time for questions at the end. And then just if you do have questions throughout, please feel free to enter them into the questions box. I will be available throughout the presentation to assist you with any technical issues you may be experiencing. And then if you have any questions for the presenters, please feel free to enter them at any time. The presenters may answer questions throughout the presentation, but there will be time for questions at the end. And then Tiffany, if you're ready to get started, I will just transfer it over. And again, if you have any issues, feel free to put them in the questions box.
Thank you, Sarah. Hopefully, make sure you can see my screen here. Okay, can everyone see my screen? Sarah, can you confirm for me?
Yes.
All right, thank you.
Mhm.
Hello, everyone, and thank you so much for the opportunity to be here today with you. I am going to be discussing a little bit about mindfulness-based stress reduction, and then Dr. Kim will be joining us, and he'll talk a little bit more about burnout and stress. My name is Tiffany Booher. My background is in psychology. I have my master's degree in applied clinical psychology. I'm the program director for the Physicians Health Program, which is a program of the foundation of the Pennsylvania Medical Society. Our mission is to promote early identification and facilitate rehabilitation of physicians and other eligible healthcare professionals and trainees with concerns relating to substance use disorders, mental health disorders, and/or behavioral concerns. Our goal is to coordinate assessment and treatment, as well as provide monitoring and advocacy to ensure the safe practice of their profession and the safety of the public. The PHP is part of the foundation of the Pennsylvania Medical Society, which is a 501c3 organization, and they serve as the charitable affiliate of the Pennsylvania Medical Society. The PHP has actually been in formal operation since 1986. Our goals for this evening. I'm going to be defining mindfulness-based stress reduction and describing how it can help manage stress. And Dr. Kim is going to get a lot more into the nitty-gritties of discussing burnout and stress, but I'm going to talk a little bit more just about how to mitigate it and the technique of using mindfulness-based stress reduction, how to do that. Participants will be able to describe 7 essential attitudes of mindfulness practice and identify different types of meditation and other mindfulness practices. Like I said, we can't have this presentation without discussing the fact that stress is real. Everyone experiences it. It's part of the human experience. Our physical responses to stress can lead to poor health. Oftentimes, we don't even notice the signs ahead of time. And sometimes people are completely burned out, but don't realize it until there's bigger consequences like problems at work or at home or even serious health issues. What I'm going to talk about tonight is something that changes our relationship with stress. Mindfulness-based stress reduction is designed to help mitigate the experience of stress and change our experience of it. So I had these really great videos embedded in my presentation, but unfortunately, for some reason, the audio is not working in the GoToMeeting. So my apologies. I will definitely send them along to Sarah so that she can share the slides with you. So you, as you have time, you can watch them on your own. This first video that I was going to show you is a video of Jon Kabat-Zinn, who is actually the founder or developer of the technique of mindfulness-based stress reduction. This originated in 1979 at the University of Massachusetts Medical Center. He developed this in order to treat patients struggling with life's difficulties and physical or mental illness. I wanted to use the video to kind of go into a little bit more about what mindfulness-based stress reduction is and get it from his point of view and his perspective, because obviously he's the creator. I wanted to make sure we included a video of him. So when you do see the video, he talks a lot about, it's just a brief 2-minute clip. He talks about the development of this and how he had brought patients to his program in the basement of the hospital, where it all started. And eventually people were starting to really see this great support of this technique being able to help alleviate a lot of their other health symptoms that they were experiencing. Oh, trying to get to my next slide here, but it's just playing the video for some reason. Okay, sorry guys. All right, so getting into the details of what mindfulness-based stress reduction is, it stems from the Buddhist tradition of mindfulness. More than 25,000 people have actually completed the 8-week program at the Center for Mindfulness. It's a flexible and customizable approach to stress reduction. And I think that's one of the things that makes this so appealing to people is you can really adapt it to what your interests are and make it fit into your daily schedule so it works for you. The two main components are mindfulness, meditation, and yoga. Um, I kind of lean away from the word yoga only because it's really about mindful movement. Some people hear yoga and they're like, oh, that's not for me. But what I'm learning in my training with this, and I actually just started the 8-week program last week, so I'm in my second week of the program, it's more about just tuning into your body and experiencing, mindful movement. Instead of following a script or acting out meticulously described steps, mindfulness is practiced in a manner that best suits the individual. And this is what I was mentioning earlier about it. It's about making it fit for what you need and what your needs are and what your interests are. MBSR is scientifically shown to be effective complement to a wide variety of medical and psychological conditions. And here's a whole bunch of conditions listed here that have been researched that have been improved with the use of an engagement of MBSR. One of the things that I want to point out here with my presentation is today I'm really just giving you an overview of what MBSR is. To be able to go into the specifics of the 8 weeks training, we need a lot more time. So I'm hoping this is going to be kind of like a taste of what you could get yourself into in a positive way if you were interested in developing these skills further and creating your own practice. Again, another really great video I was going to show about Jon Kabat-Zinn talking about mindfulness and what it really is. So what I'll do is I'll move to my next slide where I talk a little bit about what mindfulness is. Jon Kabat-Zinn describes mindfulness as an awareness that arises by paying attention on purpose in the present moment, non-judgmentally, which that non-judgmentally part's really tough for us sometimes. We have a lot of preconceived notions about how we should or shouldn't think about things. So we spend a lot of time in that judgment space. And what mindfulness does is it helps train our minds to think about this differently. And I added a quote here from John Kabat-Zinn: "This moment is the only moment that any of us ever have." And like really taking that in. So when you came to this meeting today, um, you know, most people don't just come to a mindfulness session without having some level of interest in learning about mindfulness and what that really is, and potentially developing a personal practice with it. So when you think about this moment and what that means in your mind, and becoming aware of, you know, being grateful to yourself for allowing yourself to have this time to learn, and to have this space to experience this in this moment, and just taking that in for a second and being in a place of gratitude to yourself. And that's really what kind of taking a mindful moment is just tuning in to how we're feeling in this present. And I selected this meme to share with all of you. Um, it says learn to be present and enjoy the moment. But I think the depiction of the man walking next to the horse with all of the things that are going on in his head in that thought bubble, and looking at, in our daily life, we have such a great tendency to be outside of the present moment, worrying about what's going to happen in the future, worrying about what happened, 5 hours ago, and being outside of what's happening right now. And then you see this horse who he's just right there in the moment, looking at the path that he's walking and where he's going. And 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 that's really what being mindful is just being focused on the here and the now. Mindfulness creates a relaxation response that reduces activity in the sympathetic nervous system. Your sympathetic nervous system is that part of your system that is that fight or flight response. That when we're experiencing a threat, our body responds to that threat. But if we are constantly in a place of responding to threat, responding to threat, responding to threat, um, we can end up with all kinds of stress responses with our body. So what mindfulness is able to do is help create this relaxation response that then lowers your blood pressure, lowers your heart rate, slows your respiration, your breathing rate reduces, you experience less anxiety, lower blood cortisol levels. Um, that's our stress hormone that our body releases. We have more feelings of well-being, and we experience deeper relaxation. I also wanted to share with you, this is kind of a very extensive slide. I'm going to spend a little bit more time on this one than I did on our other slides, um, to talk a little bit about the 7 essential attitudes of mindfulness practice. And this is from John Kabat-Zinn's book, Full Catastrophe Living, which he wrote in 1990. And he really goes into what kind of um, attitudes do you need to have to be successful in practicing mindfulness. And I'm going to explain each one a little bit, and I'm going to use information from his text, The Full Catastrophe Living. Um, and I love that title because it's about embracing that full catastrophe of life, and that, at any given moment, anything can come our way. And really what makes or breaks us is how we decide to engage with that moment. So the first thing I want to talk about a little bit is non-judging, and I did kind of allude to this a little earlier. in my slides, but non-judging is really um, turning off that part of our brain that's constantly assessing what's going on, and putting labels on it, and creating that evolutionary response of fight or flight for us. Are we in danger? Is this a threat? Do I need to, um, uh, prepare for, my body needs to prepare for something. Some judgments, though, especially on a personal level, become repetitive and unhelpful. They can lead to having a general sense of like not being good enough, always being wrong, or that there's something fundamentally defective about us. So as we are able to focus on this non-judging, um, we become an impartial witness to our own experience. And we develop an awareness of how quickly we instantly judge ourselves, our experiences, and other people. And in mindfulness practice, as we pay attention in a particular way, from a more neutral point of view, we're able to experience things differently. And what John Kabat-Zinn encourages people to do is to be curious and let go of the judgments, which sometimes is easier said than done, obviously. Patience is the second attitude, and patience is the act of understanding that things will unfold in their own time. Even when we don't see immediate results, it's about giving yourself permission to take the time and space necessary for mindful practices without attachment to any particular outcome, and just seeing what unfolds and allowing whatever comes up to come up for us and working with that. The third attitude is called beginner's mind. And this is, I think, in my opinion, it's a very interesting perspective, because what we're looking at is having a belief system that allows us to stay fresh, and like we're seeing everything as if is for the first time, without any preconceived expectations, um, and letting our beliefs and what we know uh, not blind us from seeing things just as they are. And so this is kind of the attitude that encourages us to have a new beginning, because our perspective is different as we go into this. And keeping in mind, like, this is the first time we're experiencing this. This is the first time we're seeing this unfold in our lives. The fourth attitude is trust. But developing basic trust in yourself and your feelings, integral to meditation training. And this is integral to meditation training. And this can be really difficult, especially if you grew up in a home where um, like feelings weren't allowed, and or you were taught to kind of just keep them to yourself and never share them with anybody else, and if it was an uncomfortable or negative feeling, to kind of push it away, and just pretend like it's not happening. So we all have these patterns, to in which we have experienced our feelings, and how we experience ourselves, that will impact this process. So coming to this from a place of trust in yourself and in your feelings, that you can trust your intuition, even if you make mistakes along the way, um, always looking, rather than always looking outside of yourself for direction. Um, this also is about being open and receptive to what you can learn from other sources. But ultimately, the intention is to find your own wisdom from within, and to trust in that unfolding, and knowing that you know, and gaining some confidence in that knowing. Number 5 is non-striving. And this one, I don't know about you guys, but I have a tendency to be an overachiever, and I really like to achieve things and to strive for things and to make things happen. That's part of my personality. And honestly, I think to make it through dental school, you have to have some level of this going on for you already. Um, so what non-striving is, it's not about non-doing, um, but it is about saying to ourselves, if only um, I, or we may say to ourselves, if only I could relax, be a better meditator, have a healthier body, then I would be okay. Suggesting an idea of how we should be implies that right now I'm not okay just as I am. And so non-striving is not the same as no effort or not doing. It's more about being present with intention while letting go of the results. And this is the most difficult mindfulness attitude to embrace because almost everything we do with purpose or goal in mind. So in the meditation domain, especially with mindfulness practice, goals are more effectively gained by backing off from striving and focusing more carefully on seeing and accepting things as they are. Um, Acceptance creates a touchstone for growth. So coming to this from a place of non-striving. Number 6 is acceptance or acknowledgement. Acceptance is seeing things as they actually are in the present moment, whatever your present physical, emotional, or spiritual state. If you don't want to remain stuck in a frustrating, vicious cycle of wanting things to be different, you might realize that this is the only time you can love and accept yourself. Remember, this is the only time you have for anything. An important caveat to acceptance is that it does not mean that you have to like everything or that you have to take a passive attitude and abandon your principles. It's simply a willingness to see things as they are right now. We remind ourselves to be receptive and open to whatever we are thinking, feeling, or seeing, and accept it because this is the key to change, healing, and sustainable growth. And the last attitude is letting go or letting be. As we start paying attention to our inner experiences, we discover a pattern of certain thoughts, feelings, past experiences that the mind seems to want to hold on to. Um, we like to allow those things to inform our new experience. If they're pleasant, we try to prolong and stretch them out, bringing them up again and again and again. If they're unpleasant, we may try to get rid of them or protect ourselves from them by pushing them away again and again and again, and kind of coming to this place of avoidance with them. In meditation practice, we put aside our tendency to elevate the good aspects of our experience and reject the not so good aspects. When we become aware of the mind's impulses to dwell, grasp, or push away, we recognize them and choose not to pursue them any further. We just observe and let go, or notice and let things be. Imagine that some aspects of life would be like what some aspects of life would be like if you could let go or let things be. Hmm. I wanted to share this quote with you because I feel like it really exudes the um, intensity of mindfulness, but also the joy that making this shift in your life brings to you. Mindfulness is about being fully awake in our lives. It is about perceiving the exquisite vividness of each moment. We feel more alive. We also gain immediate access to our own powerful inner resources for insight, transformation, and healing. And I love that this is really about turning inward for these resources and being able to then make a transition and transformation in your life and move into this place of healing. Um, One of the things that I think when we come to this place of wanting to engage in mindfulness, we're most of us are coming to this either experiencing some level of stress and burnout, or knowing that what's going on for us isn't comfortable or isn't working for us. And I feel like mindfulness-based stress reduction really brings this whole new solution, but it's also not just a solution for stress, but it's a lifestyle shift and a lifestyle change that um, helps you see the world through all five of your senses and retrains your brain to kind of be in this place of gratitude, and seeing the world in a different light. And I feel like this quote really captures that. Um, what I wanted to talk about next is mindfulness practices, and I want to check my time because I'm almost out of time already. Um, I did give Sarah some handouts to share with all of you on some mindfulness practices for you to try. I have a list here of some of the different practices that um, you know you can engage in to start um, beginning to practice this on your own. Um, the 8-week program, uh, it really asks that you dedicate 45 minutes a day to mindfulness practice. And for some people, that's just too much time, or they can't fit it in their schedule. So finding other ways to fit this in can still benefit you. And so obviously this is not a comprehensive list, but it is a starting point of some things to check out online, as well as the handouts that I sent to Sarah to give you some things to maybe give a try on your own. I did have a body scan meditation here, but since we're short on time, I'm going to just keep moving through this. Um, but one of the things that I want to point out is you can see here that, like, we've got mindful eating, we've got mindful movement, we've got mindful pause, we've got mindful driving. What I'm trying to illustrate here is, if you can't set aside the 45 minutes, you can do these activities during your day while you are going about your regular routine. So finding ways to implement mindfulness in your daily um, things that you're already doing, I think is really what can be transformational in this process and really support the benefits of mindfulness. And I wanted to share these 3 principles with you. I'm not going to read them to you, but um, one of the things is, like I said, carving out the 45 minutes a day is really challenging, but making the experience a challenge rather than a chore, and coming to this with a sense of adventure in living, rather than feeling like it's an obligation. Number 2 is that emphasis on the importance of individual effort and motivation. um, Regular disciplined practice of meditation in its various forms, whether one feels like practicing or not. And I think this is this emphasis is really about, mindfulness isn't something you just do when you feel like it. It's a lifestyle. So you have to do it even when you might not really want to, if you want to have the most benefits. Um, the immediate lifestyle change that is required, like I said, for formal mindfulness practice is that 45 minutes a day, and they're suggesting 6 days a week. Um, Again, this requires a significant amount of time, so please don't let that be a hindrance for you choosing to try some of these activities, or explore this a little further for yourself. I picked this quote from Viktor Frankl because I feel like it really illustrates our power as we look at um, engaging in a mindfulness practice. If we operate in the moment, we can harness our own inner resources to respond differently and then have a different experience. So between stimulus and response, there's a space. In that space is our power to choose our response. In our response lies our growth and our freedom. And I really like this focus on growth and freedom, because I feel like that's a lot of what this mindfulness-based stress reduction practice is about. So for your knowledge, here are 3 universities that are currently offering the full MBSR 8-week course program for you. The University of Massachusetts is where I'm currently taking the course. They have multiple days of the week available, and they're pretty flexible, and they offer it multiple times a year, so there's lots of space. The Penn State University course, I think there's one on Tuesdays and one on Wednesdays. So it's a little bit harder it may be harder to fit it into your schedule. There's a couple less options, but it is a significantly less costly than the University of Massachusetts course. And then there's also the Brown University course, and they're very similar to the University of Massachusetts course in their offerings. I also wanted to share some other mindfulness resources for you. Tara Brock has a very extensive website with lots of resources about practicing mindfulness, as well as mindful self-compassion. Jack Cornfield is also another individual who has a well-developed mindfulness website that's very helpful, has lots of resources, meditations, other activities for you to try out, as well as his course offerings are on his website as well, and so are Tara's. Usually Tara and Jack, they offer courses together a lot too, so that's also on their websites. Kristen Neff does a lot of work with mindful self-compassion. She's written multiple books, and so she's also a good resource to check out. Heal Thyself is a book by Saki Santarelli. I actually haven't read this one specifically myself, but it was recommended across the board on every mindfulness resource I went through. So I'm pretty sure it's a good one. The Miracle of Mindfulness by Thich Nhat Hanh is also available. Really, you kind of have to figure out what's a good fit for your reading style. And how technical you want to get. The Power of Now is also a really good book. I've read this one. It's very technical. It's a little existential as well, but it's a good resource if you're into want to take this deeper, I should say. I also have 10 books here that are written by John Kabat-Zinn, and I realize I just misspelled his name. Sorry, guys. So you can, sorry, I just flipped to the next slide too fast. If you look here, there's 10 books to review. Full Catastrophe Living and Wherever You Go, There You Are my 2 favorites from this list. I really like Full Catastrophe Living because it's really about embracing everything that just comes to us in our lives and finding a way through it using our mindfulness skills. The last thing I want to leave you with is a quote from Wherever You Go, There You Are. Practice sharing the fullness of your being, your best self, your enthusiasm, your vitality, your spirit, your trust, your openness, above all, your presence. Share it with yourself, with your family, with the world. Mindfulness is really designed to help you be in that moment with these people and with yourself and with everything that comes into your life. And I think it just, like I said before, creates this very powerful experience for everyone involved. I think we as a society go into this autopilot mode all the time, and mindfulness really brings us out of that and into what's happening now. So I'm 6 minutes over. I will be back at the end of Dr. Kim's presentation to answer any questions you might have. And Sarah is going to do a poll for me at the end as well to see how many of you may be interested in learning more about this technique, and we'll go from there. So thank you all so much for this time. I greatly appreciate it and for your attention. And I am going to turn it over to Dr. Kim. Thank you all.
Thanks, Tiff. Glad I got the end of that. John Kabat-Zinn was one of my first introductions into. Tiff, can you just confirm, can you see my screen here?
I can see your screen, yes.
Perfect. And before I forget, I just wanted to comment on that 45 minutes of mindfulness daily, 6 times a week. It is daunting, and it is difficult for a lot of people to engage in that kind of practice. But there's a scientific basis for it, and I often what I recommend for my patients, um, the 45 minutes doesn't have to be straight. You can break it up, whether it's 10-minute intervals or 5-minute intervals. You find that throughout the day. I think many of us, if we can't find 45 minutes, we can certainly find 5 minutes here, 5 minutes there. It takes about 4 to 5 minutes for our body to physiologically respond to stress reducing activities, though. Um, Glad that you brought that up. Thanks everyone for attending. My name is Edwin Kim. I am one of the medical directors of the Pennsylvania Physician Health Program. I'm an addiction psychiatrist by training, and I work with Tiffany here at the foundation to work with physicians and other healthcare professionals, including uh, dental professionals, as they cope with um, substance use disorders and mental illness. So today I'm going to be addressing burnout and stress. I think Tiffany mentioned this earlier. Our mission is to promote early identification and facilitate the rehabilitation of physicians and other eligible healthcare professionals, as well as the trainees, with any concern related to substance use disorders, mental health disorders, and behavioral health concerns. Our main workflow is that we coordinate assessments and treatment and provide monitoring and advocacy to ensure that our healthcare professionals in Pennsylvania are practicing safely and pursuing their careers at the same time. The goal of this presentation, hopefully you'll be able to identify and implement some practical approaches um, to reducing burnout and stress, and also understanding the resources that are available to you as you enter into the workplace um, or graduate from your programs. So first I wanted to talk a little bit about stress. Physiologically, it's a necessity. As human beings, we've evolved with stress mechanisms. Over time, it's become a subjective term, usually with negative connotations. But a lot of our understanding of stress came from the work of Hans Sale in 1936, and he came up with what we understand as the um, body stress response. And really what that meant for him was that there are non-specific physiologically to any demand for change in one's environment. So we now understand that there's good stress and bad stress. Good stress might be something like winning the lottery. Um, Bad stress may be something like getting a divorce. As healthcare professionals, I think you all understand the balance, the fine balance between stress and productivity. You can see here on this stress performance plot here, too little stress, you may be underloaded, and this comes with associated with inactivity. You're more laid back. If you increase the stress a little bit to an optimum level, you're still on that upward incline of performance. And at some point, the stress becomes a little too much, and that's right beyond the point of fatigue. When you have too much stress, you may feel overloaded, you may feel exhausted, and that may even progress into something like anxiety, panic, anger, and surely you could see the performance level going down. Uh, and if it goes too far along this curve here, um, you may experience a breakdown of emotions and something like that we like to refer to as burnout. So when someone is stressed out um, in response to negative stress, what do people typically feel? You might recognize that you have a lack of energy. This often comes associated with that adrenaline burst that you have and the amount of time and energy that you expend and how you need to recover from that. Negative stress symptom includes lack of focus, uh, worries or concerns which were manageable before, almost intellectualized or rationalized. They become more constant and you're not able to get rid of them or put them on the back. You may see reduced creativity, and uh, even times you may see negative effects on personality, and this can lead to interpersonal strain. In the workplace, stress can manifest not beyond the individual and affect your peers and colleagues. You may notice that if the stress level is high, staff become restless. Um, in the long run, you may see increased turnover of staff. Um, Day to day, you may see an increase in tardiness or procrastination, little delays here, little delays there, um, uh, deferring tasks that are assigned to one and giving it to the next person. We definitely see that peer relationships are impacted when stress levels are high. Some of the behaviors that one notices when you're stressed out is that you become egocentric. You're looking out for oneself. Um, you become a little isolated. You may become strained in communication with others. You may experience a lack of small talk or politeness, which occurred in the workplace before. And ultimately, the quality of work may suffer. You know, the fatigue and lack of enthusiasm in the work can build as your stress levels increase. According to the 2021 American Dental Association's Dentist Health and Wellbeing Survey, the majority of dentists are reporting moderate or severe stress at work. I wanted to highlight stress before we talk about burnout because one can lead to another, one can resemble another. They may sound similar, but there's clear demonstration that burnout is a clear phenomenon distinct from just being overly stressed. Burnout is a workplace phenomenon. It is a pathological syndrome or collection of symptoms in which there's emotional depletion, maladaptive attachment that develops in response to prolonged occupational stress. One of the uh, foremost researchers in occupational burnout was Dr. Christina Maslach. And you may hear at the presentation because a lot of these burnout studies um, incorporate what's called the Maslach burnout inventory. So she hypothesized that burnout is the index of dislocation between what people are and what they have to do. And it represents an erosion in value, dignity, spirit, and will. And at the very core, uh, it may even be an erosion of the human soul. Maslach Burnout Inventory is a 22-item survey, and it covers dimensions of emotional exhaustion, depersonalization, feelings of incompetence, feelings of cynicism, and professional inefficiency. So you can start to see that this goes beyond just the typical feelings of feeling overstressed individually or having your workplace be demonstrating a lot of stress. Exhaustion may be categorized, described as feelings of emotional overextension and exhaustion by your work or schoolwork. The burnout causes a worker or student to feel as though the demands of the job or school are insurmountable. So, of going beyond on the tail end of that stress curve, feelings of hopelessness, pessimism, and a lack of optimism. So you're really overextending yourself there. Cynicism, you may see callous or impersonal reactions to your staff, your coworkers, and even to patients. The passion that you once felt for your work is replaced by this cynicism and can lead to a sense of depersonalization. Depersonalization is a very real phenomenon where when thinking about oneself, you don't seem like yourself. You don't feel like yourself uh, from day to day. In burnout, you may see loss of professional effectiveness. This is accompanied by feelings of incompetence, poor achievement, and low motivation. And this sense of loss may be completely incongruent with the reality of how you're performing, or it may be in a positive feedback loop where it feeds on itself and actually does cause ineffectiveness. Essentially, burnout does cause one to his or her self-worth and professional effectiveness. There's some clear signs that we see in burnout. Um, Early on, you may experience sleep problems. At the very worst, you may experience nightmares or very vivid dreams, which you didn't experience before. You may start to notice that uh, you may see disruptive behavior in those that are burned out. Again, you may see someone withdrawing socially. Uh, Again, it's an extension of feeling stressed or someone becoming more isolated or egocentric. Um, There may be violations of professional and personal boundaries. Poor judgment may result from burnout. Perfectionism and rigidity, kind of counterintuitive, but almost like a defense mechanism that um, things need to be absolutely perfect. And without that perfection, you're not an effective clinician. When someone is burned out, you may question your profession or even life. And sometimes in the field, at its worst, to cope with these feelings, the overwhelming stress, or when it becomes burnout, uncharacteristic alcohol use, or substance use, or trying new things that you previously hadn't considered before. So stress versus burnout. Stress, what you might see are overreactive emotions, responses to other people, responses to your environment. You may start to feel physical symptoms, but it's an adaptation of the current situation, time, or environment. Progressing to a burnout, a picture of burnout, again, someone burned out has a sense of helplessness and hopelessness. You may notice a blunted state, and blunted here means kind of dampened down. They're not as lively. They're not emoting as they typically would. It takes more than the physical toll. All your emotions are at stake, and there is a breakdown of the um, adaptive skills that were once helpful in that stress state. But in burnout, there's a complete breakdown of that. I want to bring the Maslach burnout inventory uh, questions to the presentation, and you can close your eyes and just simply look at the questions I pose to you. I feel used up or worn out at the end of the day. I feel emotionally drained or exhausted. I feel fatigued when I get up in the morning and have to face another day on the job or in classes. Working with other people all day is really a strain for me. I feel burned out from my work or studies. I feel frustrated by my job or school. Working with people directly puts too much stress on me, and I feel like I'm at the end of the rope. If you start to identify with any of these statements, this may be a sign that you're on the verge of burnout or already or experiencing burnout. Do you feel like yourself? Um, I feel like I treat some coworkers, staff, patients as if they're impersonal objects, simply there to serve my needs. I've become more callous towards people. I worry that my job or school is hardening me emotionally. I do not really care what happens to some people, or I feel people blame me for some of their problems. And again, if some of these feelings start to ring true, again, these are signs that you may be burned out. Is it difficult to sense your personal accomplishment? So listen, this kind of takes a different approach. If you see if you agree with these statements or disagree. I can easily understand how my coworkers, peers, or patients feel about things. I deal very effectively with problems of others. I feel that I am positively influencing other people's lives through my work. I feel very energetic. I can easily create a relaxed atmosphere at work or at school. I feel exhilarated after working closely with others. I have accomplished many worthwhile things in this job or at school. In work or at school, I deal with emotional problems very calmly. If you tend to disagree with these or some of these things start to become, you're not able to identify with these things, again, disagreeing may be signs that you're burned out. Burnout is a real syndrome. In the physician, about 40% experience burnout in the workplace. In the dental field, uh, the actual prevalence isn't quite known, and yet it remains to be studied extensively. But you can imagine um, it has the potential of being very high. In a survey of of, uh, of dentists nationally, approximately 1 in 10 responded reported high levels of burnout. A survey of 167 dentists who were attending a conference, 13% of those had experienced burnout. And there was a statistically significant association between burnout risk and engagement in work. Among new dentist graduates, a total of about 100 dentists, anywhere with experience ranging anywhere between 6 months and 5 years since graduation were surveyed. About 97 dentists replied, and they found that there were some factors most commonly responsible for professional burnout. Most commonly, less energy, less time for family and friends, frustration, feeling worn out at the end of the workday, feeling that every working hour is tiring. Again, emotional exhaustion, feeling worn out at the end of the day, and exhaustion in the morning at the thought of another day at work. In a sample of pediatric dentists, about 23% of respondents had feelings of high emotional exhaustion. Respondents, about 1 in 10 had high depersonalization. About 1 in 10 had low sense of personal accomplishment. Again, different dimensions of burnout. 9% fulfilled the study's definition of occupational burnout, which was defined as high emotional exhaustion and high depersonalization. 7% of respondents had moderate to severe depression, which was correlated with high emotional exhaustion, high depersonalization, and low personal accomplishment. 2 out of the 5 respondents with occupational burnout also had moderate to severe depression. And in this survey, there were no gender differences in the prevalence of burnout or depression. In a systematic review in 2016 from Ireland, about a quarter of dental staff were at severe risk of burnout. 80% of Lithuanian dentists reported burnout. Dentists demonstrated that there was no major relationship between age and burnout, but men aged between 40 and 50 scored higher in depersonalization and the emotional exhaustion subscales of burnout. In Dutch dental residents, there was higher stress and burnout in females. And in a study of Jordanian dental students, there was a of burnout in females, in particular in that emotional exhaustion dimension. Interestingly, the review showed that there was increased burnout in male dentists, practicing dentists in their career, as opposed to higher or increased burnout in female trainees. In a study of Saudi dentists, the prevalence of burnout in dentists was found to be 3, and Saudi dentists experienced more burnout than non-Saudi dentists. Among dental specialties, prosthodontists and endodontists showed more prevalence of burnout than other specialties. Dentists who work in clinical settings and who work more than 40 hours per week experience more burnout than others. In a study of Brazilian dental students, showed that the Maslow burnout inventory of students was reliable and valid, and among these students, 17% had burnout syndrome. We really try to ask what is it about the dental profession or healthcare professionals that can lead to burnout? So we know that increased occupational stress, but it's also hypothesized that the personality types may play a factor in this. There are certain personality types that experience lower burnout, and that's the ISFJ, introverted sensing, feeling, judging, or the ESFJ, extroverted sensing, feeling, judging, or the ENFP, and I forget, intuition, feeling, extroversion, intuition, feeling, and perceiving. And then in the personality types that experience more burnout are the ISTJ, the introversion, sensing, thinking, judging, or the ESTJ, extroversion, sensing, thinking, judging. And those are characteristically the type A personalities. And sure enough, dental students and professionals tend to be more type A personalities. There is a culture of perfectionism in dentistry. It's what we call a zero defect environment. And that's where you as dental professionals and clinicians and staff, there's an expectation to deliver excellent and effective care. And regardless of what's going on, each single patient expects that excellent care. This in reality is this in practice is unrealistic and really sets us up for failure as healthcare professionals. When perfectionism is not met, we become easily frustrated. When our ideal therapeutic goals are not met, the demands of the patient or even the clinician's high aesthetic demands play into perfectionism. And there's a technical and both technical and creative aspect to this, in which leads to perfectionism. And just in general, the nature of your work, behaviors are meant to propagate this. I just want to read this quote here. You must be conscious of patient satisfaction and quality indicators. You must avoid liability, but not over-order tests. You must document extensively, but not keep patients waiting. You must comply with every new administrative regulation and keep up your board certifications. You must, of course, achieve those all-important productivity measures. And I think this comes from a physician, but I think it translates well into the dental professional as well. Dentistry, characteristically, there's a lot of occupational stress. As clinicians, you hold high moral standards. It's a long, hard, and challenging course of skill and knowledge acquisition. As practice owners or employees, you often find yourself sitting in that authority role, which can lead to stress. As clinicians, you're expected to produce, and so these excessive workloads and overworking increases that occupational stress as well. And there is a sense of responsibility for lives and the health of others, which contributes to stress. And just in general, typical of the type A personality that many dental professionals are, there's just an urgency to be productive and to work. So there's a lot of inherent conflicts built into dentistry. So on a personal level, you want to increase your income or your revenue. You want to control access to your schedule, to your care. You want to be able to practice ideally in as few locations as possible with as little overhead as possible. Flexible scheduling is always nice. Maintaining regular daytime hours during the week for most professionals is key. And ideally, you'd like to reduce overbooking, and at the end of the day, have autonomy over your clinical practice. And this just inherently conflicts with the needs or wants of a patient, who on their end want lower rates, they want to pay less, they want increased access to you, to care, when they want and where they want. Preferably, there's more locations that they can attend to. There's increased services available. They like to set appointments according to their needs. Patients are busy themselves, so they expect or appreciate clinicians who offer extended hours. Patients demand short wait times. And again, on their end, patients want their autonomy as well. So you can see just how inherent conflicts stress in the work that you do. There's some causes. Um, there's causes of burnout that people identify over time. A sense of being devalued by society or their patients or healthcare system or your clinical practice, feeling like a cog in a wheel, sense of loss of autonomy, a lack of information, threat of malpractice, pressure to verify or to learn new skills or to gain the newest tools, long hours, reduced pay or reimbursement, the loss of that patient-physician or relationship, online or grading or rating systems, government regulations, dangerous workplace environment, dealing with new electronic medical records, pre-authorization process, or even restricted covenants or non-compete clauses. If you want to learn more about burnout from Dr. Maslock, this is an excellent book on how burnout originates from how organizations are structured. Because burnout doesn't always come from within. Um, it's often recognized that the structure of an organization leads to an environment that contributes to burnout. I want to bring this, the causes of burnout, which have been well characterized in physicians, but not necessarily dentists, but some of these may translate. So in healthcare, too many bureaucratic tasks can cause burnout. Spending too many hours at work, income is not high enough, increasing computerization of practice or documentation requirements, feeling just like a cog in the wheel, too many difficult patients, too many patient appointments in a day, inability to provide patients with the quality care that they need or want, lack of professional fulfillment, difficult colleagues or staff or employees, inability to keep up with current research or recommendations, compassion fatigue, or a difficult employer. And again, similar to dentists or in any healthcare professional, there's this orientation or culture of high achievement. There's healthcare professionals are experts in delaying their own gratification. We often have difficulty setting limits. There's an excessive demand of self. We often deny our needs and criticize others for expressing their needs. We deny mistakes to avoid punishment, and we learn to appear self-sufficient. And again, that culture of perfectionism at play. We started to mention a little bit about mental health. In August 2020, the American Dental Association Health Policy Institute found that during COVID-19, over half of dentists at the age of 35 were not familiar with mental health or other supportive services. Over 30% were not comfortable seeking out mental health services for themselves or team members. And so this was early early in 2021. Essentially what this survey showed was that there is continued mental health concerns for dentists, including anxiety and depression. Stress can worsen mental health, and I wanted to differentiate mental health a little bit from burnout. Burnout is a occupational phenomenon, and these can operate independently, or there can be comorbid stress, mental health issues, or burnout. So I want to just highlight some signs of depressive disorders or low mood, little interest or pleasure in doing things, feeling down, depressed, or hopeless, trouble falling asleep, staying asleep, or sleeping too much, feeling too tired or having little energy, having poor appetite or overeating, feeling bad about yourself or that you're a failure and have let yourself down or your family down, trouble concentrating on things such as reading the newspaper or watching television, moving or speaking so slowly that other people would have noticed, or even the opposite, being so fidgety or restless that you just can't you can't sit still. And at the far end of the spectrum, or severe end of the spectrum, thoughts that you would be better off dead or hurting yourself in some way. So you can see some intersection here with the criteria for a mood disorder that intersect with burnout or feeling overstressed. It's important to recognize that if you're feeling any of these things, that you may be experiencing a form of depression. Anxiety is of concern. If you're feeling nervous, anxious, or on edge, if you're not able to stop or control worrying about things that are out of your control, worrying about too many different things. For example, if in a day you worry about one or two things, that's manageable, but all of a sudden if anxiety is becoming overwhelming, you're worrying about every single aspect of your life, whether it's at work, home, school, all inclusive. Sign of anxiety is that you have trouble relaxing, being so restless that it's hard to sit still, become easily annoyed or irritable, or feeling afraid as if something awful might happen. That sense of dread or fear. So these are signs that you may be suffering from anxiety. And again, some of this intersects with mood disorders. Some of this has similarities with feeling overstressed. And again, uh, some of this intersects with feeling burned out. Insomnia is a big concern. If you're having trouble sleep at night, if you find yourself lying awake for long periods of time, if you're waking up several times even after falling asleep okay, if you're waking up early and unable to get back to sleep, if you're not feeling refreshed even after sleeping a certain quantity of hours, if you're feeling fatigued or sleepy during the day, if you're having difficulty focusing on a task, or if you're feeling irritable. These may be signs that you're suffering from some kind of insomnia. And again, some of these symptoms with mood, anxiety, feeling overstressed, or potentially even burned out. So this all kind of interplays together. Burnout left untreated or unaddressed. There is not a perfect correlation, but sometimes we do see it progressing into depression or worsening a pre-existing depressive disorder, and at the worst can cause suicidal ideation. Consequence of burnout is substance use and or addiction. In our older, well-seasoned dentists, we see burnout prompting early retirement or even changing careers. It's been demonstrated that patient care errors do occur with increased burnout, malpractice exposure, and even family and social dysfunction. And I should highlight that if someone is starting to demonstrate um, symptoms of burnout in the workplace, it's usually one of the last places where it's manifesting. If burnout is something that you carry with you throughout the day, um, uh, but you start to notice yourself experiencing the burnout at work, really a sign that things have gotten a point of needing some intervention. So in 2016, the American Dental Association surveyed um, about uh, uh, surveyed dentists. About 400 dentists responded. About half of the respondents had a concern for dental error in the last 6 months. 12% of those dentists were informed by staff that they may have committed an error in the last 6 months, and 16% of those were concerned of a malpractice lawsuit. It was shown that dentists with higher burnout risk were more likely to report the concerns about the perceived error in the last 6 months. Um, Mental health and dental hygiene was looked at in dental and hygienist students. About 100 third and fourth year dental students and 30 first and second year hygienist students were surveyed. And it was found that 40% of dental students and about 40% of hygiene students met the criteria for burnout. 6% of dental students, 9% of hygienist students were above the cutoff for clinically suicidal ideation. And in this, it was shown that depression was associated with burnout and that suicidal ideation was related to the lack of personal um, accomplishment dimension of burnout. Again, substance use is a big concern. The American Student Dental Association survey in 2019 received responses from students, and the 30-day alcohol usage and binge drinking rates were higher among dental students than college-age students. Women's 30-day prevalence of alcohol use was slightly higher than men, but binge drinking prevalence was higher in men. The prevalence of binge drinking was higher among white students, as was mean drinks per drinking occasion. Students who self-reported below average academic performance were likely drinking to get away from problems and had a higher prevalence of some alcohol-related problems. And just to highlight the national recommendations for drinking, 2 drinks um, per day, 7 days a week, so a max of 14 drinks per week. And for women, 1 drink per sitting, 7 days a week, so upper limit of 7 days, 7 drinks per week is the national cutoff for healthy drinking, or and anything beyond 5 drinks in a sitting would be considered heavy drinking. So how do we cope with burnout? We have to recognize that burnout is rooted in the individual as well as in the workplace. And this will be important because as dental professionals, you're not only responsible for yourself, but as likely leaders of your clinic, you will be responsible for your colleagues, your staff, and your employees. So preventing burnout is essentially finding a balance of things. A balanced life integrates multiple dimensions of your life. There's healthy balance between physical and mental health, your work, partners, focus on family, friends, you're exercising, you're strengthening your spirituality, you're tending to your household, tending to your personal needs, and finding ways to have fun and seek recreation. When there's an imbalance of these things, a lot of medical and dental professionals really are focusing a lot of their time and effort on that work aspect. So the individual responsibility for managing burnout, some tips, protect your time with family and friends, carve out time, schedule things, formulate realistic financial goals, set aside time to do nothing. Some people like to schedule nothing on your calendar or break time. If you're inclined, you can support humanistic values or engage in community service. Absolutely try to focus on getting an appropriate amount of sleep. You can build physical activity into your daily routine, getting steps in where you can. Um, remember to eat healthy food, avoid excessive alcohol and caffeine. Learn relaxation techniques such as yoga or meditation, such as mindfulness techniques. Um, and also exercise that creative part of your brain, as many dentists have, and try to find new hobbies or engage in hobbies that have gone to the wayside. Find ways to connect in the workplace. So as an individual in a group of other dentists, um, assistants, and administrative staff, burnout can occur when there's a disconnect between all the stakeholders in the organization. So one way to look at this is finding ways to manage a reasonable workload, give people the autonomy that they desire and control over the things that they can, essentially have build allow people to have a say in their workplace. Acknowledge and compensate appropriately. This can be financial, but also um, allowing staff or yourself to take time that you need to tend to your personal needs. Creating a positive workplace environment is a proactive effort. So building that sense of community, learning how to engage with others, and in showing a genuine interest in your coworkers can build that sense of community. Treat people with respect, be just and fair in the way with not only accomplishments, but also friction. And try not to single out any one particular staff member or coworker. And identify and build a common shared set of values to which you and your coworkers can find yourself adherent to. Um, from an organizational standpoint, again, burnout can originate not from the individual, but from the actual workplace environment as as practice owners, as essentially the authoritative figure on treatment teams. It may be up to you to stand up and say, how can we change the workplace to promote wellness or to combat burnout? And so some things that you might want to incorporate are establish wellness days, create meetings or activities that are meant to promote wellness. If you want to have a collective mindfulness section or schedule in stress relieving activities, that's one way of engaging everybody in well-being activity. Schedule retreats that focus on team building and self-awareness. To be honest, I don't know how many dental practices out there do this often enough. But if you're working on a team day in, day out, um, being able to build those team skills, absolutely critical. Schedule brief, regular staff meetings to discuss stressful situations, to debrief, to decompress, to strategize how to work with difficult patients and also the challenging cases. Sometimes having a plan um, or strategy can help, but remember to keep those meetings brief. Promote staff control of the work environment. Again, you're working in a team environment. Each individual has their special tasks or there's a role, and the more that that individual has a say in how they conduct their work or have a say in the workflow, um, uh, the less chance of burnout. Promote part-time careers and job sharing. I think um, in the dental profession, this is a little bit easier than in the medical field. But uh, if someone or staff or FDAs or admin have other obligations, allowing them to tend to that and having focusing on part-time careers, or um, as practice owners or clinic owners, allowing new dentists to engage in the clinic just part-time rather than committing their entire work week. That can also promote uh, a sense of well-being and combat burnout. Stress is going to occur, and it's up to you to actively manage that and keep that in that sweet spot. So take breaks for mindful breathing and visualization. Tiffany mentioned 45 minutes a day, 6 days a week. You don't have to start off with that. And often people starting off in the practice of mindfulness rarely accomplish that level. But if it's 10 minutes a day, when you remember, or when there's a patient a canceled appointment, uh, rather than moving on to the next task, maybe give yourself a break to do some mindfulness meditation. If it's a busy day in the clinic, try to take breaks outside of work, find creative outlets. Again, find that dental professionals have this creative side to them. In channeling that energy can reduce stress. Be proactive in creating a safe and comfortable environment. That creates a culture where others can start to feel like they can contribute and also want to create a safe and comfortable workplace. Focus on the positives. Um, Big part of resiliency is being able to not avoid chaos or crises um, or difficult emotions or stress, but often in resilient people, there's an ability to positively reframe things. So looking at the silver lining or finding the positive after dealing with the stress. Maintain your personal connections. This is certainly a proactive suggestion. Um, Everyone, rather than isolating and just reach out to your coworkers, colleagues. Um, and if some of these things don't work on an individual level, um, always consider seeking professional help, whether it's counseling, therapy, um, and if or groups, uh, mutual help groups. If those don't seem to do the trick, um, always seeing a psychiatrist to discuss medications, or your primary care physician to ask about medications another way. So as dentists, you serve as models. As you go into clinical care, your employees and assistants look to you and how you take care of yourself. Your patients, as soon as they step into the clinic, they look at how They look at the demeanor of staff, and they look to the doctor to see how stressed they are. Doctors are role models for children at home and family members. Um, Doctors who take care of themselves can have higher patient satisfaction and safety scores, less dental errors. If you're taking care of yourself, uh, you will experience less and potentially less burnout. Um, and all that said, with the potential of living longer. Benefits, clearly, clear benefits of managing your stress and preventing or reducing burnout include decreased clinical errors, increased patient satisfaction, better treatment recommendations as you're engaged and concentrating on your work, increased treatment adherence by your patients because they're engaged in the treatment making process, potentially lower malpractice risk, better attitudes towards work, higher team functioning, and lower turnover rates. Um, Again, I wanted to highlight our role, your roles as the authoritative figure in your clinics. And you have a responsibility and the ability to promote well-being and engagement. And that's by taking a leadership style that is emotionally connected, psychologically safe, empowering, and optimistic. What does emotionally connected mean? We feel positive and cared for when another person pays full attention to us, is empathetic and puts themselves in our shoes. We feel actively bad when the other person is disengaged, out of sync. So in order to build emotional connection with staff or your coworkers, be warm, fully attentive, listen with full uh, attention and intention to what people are experiencing. Uh, Prompt maybe what are they experiencing and why. Paraphrasing what you heard can be a good emotional connection. Examples are, I hear you say your experience is X in response to Y. Follow-up questions uh, show that you're engaged in conversations. Some example questions are, what does this mean to you? What pleased you or what upset you the most about this? Psychological safety is important. We feel safe when we know what to expect and we give consent to it. We're free to think out loud, to speculate, and to express freely and fully. Where we won't lose face or be rejected if we ask for help or acknowledge a problem, admit a mistake, seek feedback, or disagree. And there's this baseline assumption of goodwill. Psychological safety doesn't occur when the purpose and rules of the conversation are ambiguous or unknown, or it's been demonstrated that it's safe to express ourselves in the workplace or in personal relationships. How to establish psychological safety. You can set the person at ease by letting them know what to expect from the conversation. Framing a conversation, stating the purpose, defining the roles that each person will take, and the process um, uh, that you'll follow. For example, I'd like to talk briefly about covering for Dr. X or Mr. or Mrs. Y while she's out, and reach out about what you can do. Or why don't you start telling me about your availability? I'll add what I know, and then we can discuss any gaps. You can create psychological safety by not arguing. You can show curiosity about pushback or negative expression rather than a full-blown emotional response or even avoiding conversations. As leaders, you have the potential and ability to be empowering. So people feel empowered when they're allowed or encouraged to choose where to invest themselves. and how to align with what rewards them individually. So accomplishments, finding solutions, developing skills, making connections. Empowered or made to feel helpless when they're told what to do, or when rewards are solely external, salary, status, or praise. So there is empowering talk. So you encourage self-awareness. How are you doing with a new protocol, for instance? You encourage self-assessment, checking in with staff and saying, what did you do specifically that worked? What made it work? What didn't? Encourage choice and self-initiation. This happened this time. What would you do differently next time? You can encourage identifying intrinsic motivations. What would it mean for you to try that out or this method out? You can also encourage identifying resources. If you feel like you need help, how would you like me to be a part of that? And again, promoting optimism. You can promote emotional states, which helps us function in general. The frequency of positive emotional states is what matters. It's important to know that we have control over our emotional state when we change our focus of our attention. Again, with the practice of mindfulness, one of the benefits or positive consequences is that one starts to be able to switch their emotional states more readily, potentially. Focusing on positive experiences lifts our mood, and asking questions help direct the other person's attention. How do you focus on the positive? You can reflect back in time, what went well, or what helped you do well, or even more back in the past. Remember that time when you did this well. How did you accomplish that? You can reflect on today. What is working now? You seem to be on point or this week. What's going on to make it work? And then project forward in time. Uh, what might you accomplish this year that would be especially meaningful to you? So really engaging with staff or your coworkers or junior clinicians to really get that sense of well-being in the workplace. And again, um, when dealing with stress, burnout, mood, anxiety, it's not always about prevention. Sometimes things just tip into not being able to control on our own. So we always encourage people to seek professional help, counseling, support groups, individual therapy, group therapy, or even a psychiatric evaluation if needed. Some online resources, easily digestible videos at psychhub.com. SAMHSA is an excellent way to find mental health resources across the nation. If you're ever feeling suicidal or wanting to take your own life, I'd encourage you to take this down, the National Suicide Prevention Lifeline. They even have a text-based hotline where you can just text and converse with a counselor through texting. I included some helpful links for future reference and some online resources dedicated to promoting wellness and reducing burnout in the workplace. In addition to Tiffany's resources for mindfulness, I just want to highlight UCL Mindfulness Awareness Research Center, some excellent guided meditations, and then also another excellent course, University of Pennsylvania's program for mindfulness. You can find various coursework. And I will take questions with Tiffany here in the last few minutes. I see a question here. Why reduce caffeine to reduce burnout? Yeah, Cecilia, excellent question. I think, a healthy amount of caffeine is okay, right? Um, Gets us up in the morning, stimulates us, gives us a little bit of energy. Um, Caffeine as a crutch, though. Caffeine to make up for a lack of sleep, to make up for insomnia, or to be used to lift your mood. I think those are that's beyond the threshold of what we consider healthy caffeine use. Anything that masks symptoms, we generally advise participants or professionals to avoid. And that just comes down to getting to the root of the problem and finding effective ways to cope with stress, burnout, mood, or anxiety symptoms. I see a hand raised. Don't know if that individual wants to turn on their mic. Tiffany, I had a question for you actually. How many minutes a day and how many days of the week are you finding yourself practicing mindfulness in your the early part of your studies?
So right now I'm only doing 15 minutes, like as a dedicated practice, but I find myself throughout the day catching, 3 to 5 minutes here, 3 to 5 minutes there. So maybe total like 20 minutes, 25 minutes on average right now, because I'm just starting out. Um, I think one of the things that's difficult is so I'm Dr. Kim already knows this, but you all don't know this. I have a 19-month-old daughter. So finding time in my schedule to be alone and do this has been an interesting part of my process of learning how to make this work for me. So I want to acknowledge to everyone that, it is sometimes difficult and you have to commit to getting up a little earlier or, um, rather than watching TV in the evening, spending time, in meditation instead. So I've had to kind of make that shift. So that's a long answer, but yes,
Yeah,
that's where
15
I'm at
minutes
right
is excellent. Yeah. We have a question. What's the name of the Mindfulness and Chaos book? Do you remember, Tiff?
I can pull up my slides here.
Yeah, do you want to pull up that
Talking
slide
about full
of,
catastrophe living. I'll pull up the
I
slides
just
here
gave you
quick.
control if you want to pull up that slide.
Sure.
Tiffany, while you're doing that, I'm going to launch the poll about the mindfulness.
Perfect. Um, can you all see my screen, my slides?
I actually see a poll now.
Yeah,
Okay.
just give it 1 second as soon as I
Do the poll
end the
first.
poll.
Yeah.
Yeah, I'm just going to leave it up for just a couple more seconds and then I'll
Yeah,
take it
take your
down.
time. No worries.
Okay. Yeah, I'm
I
going to close it now and then you should be able to show your slides.
thank you, Sarah.
Mhm. And then that was the results. So there was a big astounding yes
Okay.
for
Fantastic.
further training.
Thank you so much for doing that, Sarah, for me. It's very helpful and gives me some information to go back to our executive director with. So I appreciate that very much. Thank you. Um, can you all see my slide here? I don't have it in the full, like, can you see it, Ed?
Yep.
Yeah. I don't have it in the full view, but I think the person was asking about the chaos text, but I think it's Full Catastrophe Living was the book that the individual is referencing. So, but here's the slide with the 10 books. He has lots of other books that he's written, but these were the 10 that I felt fit what we were kind of discussing today and would be supportive in creating your own personal practice. I feel like I'm still in like the infant stage of this whole process. I've had my own personal mindfulness practice since my early 20s, but it has ebbed and flowed, obviously, as life has ebbed and flowed. And I'm really excited to be on taking this 8-week course to really delve into it a lot deeper and see how this does support mitigating burnout, and being able to share my own personal experience with that, as well as being able to share this maybe at a deeper level with everyone. 30 minutes was like, it was so hard to write this presentation because I was like, there's so much. So yeah.
Yeah, can't say enough about mindfulness meditation. Even after 5 minutes, a brief breathing and visualization meditation, most people sit there with their eyes closed, imagining and getting into, and you can tell they're focused. And it isn't until they open their eyes and take a breath that you just see that tension kind of release from their body, their shoulders, and you're just like, wow. And they're like, wow, was that really just 4 or 5 minutes that I just sat through? Because I feel
Mhm.
great.
Yeah, the body scan meditation that I had was going to play for everyone today that we didn't really have time to get to. um, that really goes through that process, and it's so short. It was like 2 minutes, but our my the course director who's teaching my class, she actually took us through it as part of our orientation, and it was very simple, but bringing yourself back into your body and taking a moment to just be. For many of us who are, on the hamster wheel all day, every day, it was like, I was like, wow, I felt so refreshed and it was only 2 minutes. So I definitely think there's a utility to this, in what you were saying, Ed, in regards to being able to just implement this in small spurts throughout your day to support you, and to help manage some of this stress that we're under, but whether it's really intense stress or just the simple day-to-day trying to balance the competing demands of our schedules and all the you know different realms of our lives, our families, our work environment. It's a lot. So are there other questions? Anybody else? I don't think I see any other hands up. Do you, Ed?
I don't. Looks like we got them all.
And please feel free if things come up for you as you take a look at the resources and the handouts we've sent you all, or Sarah will be sending to you. Please feel free to reach out to us, send us an email message, give us a call. We're happy to chat about this further with anyone who's interested.
You want to slide? You want to scroll down to that last slide there
That's a
with
great
our content?
idea. Hmm. So there's our contact info. Like I said, Ed and I are readily available to all of you as a resource. We're here to support you in whatever way we can. Um, please, please reach out.
Thank you all.
Thank you very much.